Most of the individuals are interacting with infected birds and animals, and then there have been several cases where we don't have a specific history of that individual interacting with an animal or a bird that might be infected. And so that's why we're cautious and somewhat concerned, because the question arises, how did those several individuals become infected? Right now, the primary means of transmission is from individuals interacting with an infected bird or an animal like a dairy cow, handling a sick or dead bird and then self-inoculating the virus into your eyes, nose, or mouth, or working with a dairy cow and becoming infected during the process of collecting milk. We have not seen documented human-to-human transmission of H5N1 yet. It's really important for those who work in bird facilities or work on farms where there's dairy cattle, when you're interacting with the animals or debris from the animals, that those individuals wear a mask, eye protection, and gloves. Many of the individuals who have been infected following exposure to dairy cattle are again coming down with conjunctivitis because the virus is being introduced into the eyes, and there's receptors that the virus binds to in the eyes, and so wearing that eye protection is important as well. We've seen now multiple years, 4 years now, of this growing outbreak among birds and animals and in mammals, with millions of poultry being affected in the US and worldwide. We're seeing a growing number of human cases. Fortunately, those cases have been mild so far. But what we know about influenza is that the more it infects animals and humans, the better the chance it has to change and mutate, and it's a numbers game. The more times that happens, the greater the probability that a virus will arise that can transmit effectively between one person and another and cause severe disease.